Julia Robinson is a speech language pathologist with over 25 years of experience who values evidence-based practice. She's a part of the outpatient neurological team at Legacy Emmanuel Center. She specializes in cognitive linguistic disorders, swallowing, and voice. She works a lot with our head and neck cancer patients, and she facilitates the monthly community head and neck cancer support group through the Legacy Cancer Institute. She's a member of the Brian Grant Foundation Medical Advisory Council for Parkinson's disease, teaches the weekly Parkinson's communication skills class, and is certified in loud voice therapy treatment for Parkinson's disease. Julia also enjoys spending time outside with her husband and two children. Thank you guys for joining us today. I'm going to let Julia take over from here.
Thank you, Lori. Thank you for having me. Welcome, everyone. All right, so today we're going to talk a little bit about some strategies for coping with chemo brain. I'm going to briefly go over history, prevalence, and prognosis, but the majority will be on strategies and hopefully takeaways for everyone. So a little bit of the background. The first studies about chemo brain were published in the 1980s. Those studies were on what we're calling chemo brain. The term, though, didn't take effect until the late 90s. The studies were originally done with first studies with breast cancer patients showing cognitive changes in the setting of chemotherapy. But in the last 20 years or so, there's been a growing appreciation of cognitive difficulties, not just as a consequence of chemotherapy, but cancer itself and other cancer treatments. And thus the name change has gone from chemobrain to cancer-related cognitive impairment, or CRCI. During the talk, though, I might refer to either chemobrain or cancer-related cognitive impairment. So bear with me. All right, next slide. What is cancer-related cognitive impairment or chemobrain? Well, it most often affects memory, attention, executive functioning, which are things such as organization, problem solving, reasoning, time management, and processing speed. Other examples might include feeling foggy, mental fog, memory changes, forgetfulness, changes with the verbal skills with word finding or just being able to express yourself in conversation, trouble with making decisions, learning new information, and slower processing information. When I looked up the latest research on prevalence of the cognitive impairment from cancer treatment, it seems to vary greatly, and it also varies depending on how it was assessed. Was it by a patient questionnaire? Was it by testing? It varies based on cancer type and timing. Most research, there's a pretty big range of reported cases from 20 to 75% of people during active treatment, and also varying between 15 to 50% after having chemotherapy. Most of the information that I found was with the breast cancer population, although I saw similar findings reported in other cancers. Prognosis. So the prognosis for cancer-related cognitive impairment is generally favorable for most people, with symptoms improving over time. There's a small percentage of people who experience ongoing difficulty. Most people experience the greatest decline with cognitive skills either during or shortly after chemotherapy. And most people see improvements within 1 to 2 years after treatment. The one thing I want to point out to keep in mind is that, cancer-related cognitive impairment is not a progressive neurodegenerative disorder, meaning you should not see that it's getting worse over time, that over time symptoms should become stable and improve. There are some things that can affect our thinking, our cognitive function, which we'll go over a little bit more later, but just a brief overview, excuse me. So sleep disorders, if you have sleep apnea or insomnia, that can affect your thinking. Depression, anxiety, pain, stress, other illnesses can also affect your thinking skills. The good news is what's called neuroplasticity. It's how our brain is able to adapt. It's able to change or rewire. And we find that having good habits and good experience can help your brain in healthy ways. And like I said earlier, most people see a nice recovery within 1 to 2 years after treatment. So the next slide is talking about neuroplasticity, or how the brain adapts. I want to go over this and explain a little bit more. It talks about use it or lose it. I'm sure you've heard that, use it or lose it, in terms of physical exercise. Well, the same thing applies to our brain. It means that if our brain is not actively engaged, our performance can decrease over time. So if you find small things to challenge yourself and stay active, that is good for your brain. Even 5 to 10 minutes a day of reading or listening to audiobook, drawing, organizing a drawer, keeping busy, this regular engagement enhances our brain's connections. Next, use it and improve it. This is about how repeated practice, such as a card game, is considered mental training, and it can enhance our brain's skills. It's not only preserving the brain's ability, but it's also improving skills by repeated targeted use. Next, specificity. Meaning if you're having trouble thinking of words, for example, or word finding, you would want to practice language skills such as naming exercises, talking more, word searches, etc. Repetition matters, number 4. Repeated practice or exposure during memory training helps enhance our brain's performance. So for example, if you take your pills every day at 9 a.m., the repeated performance of taking it the same time every day helps strengthen memory, builds routine, and helps with long-term retention. It helps promote and make it more automatic. Or another example would be of repetition would be putting your keys and wallet in the same basket in the kitchen every time you come in your home. Number 5, intensity matters. You want to do things that challenge your brain. With the principle of memory training, you want to do tasks that are increasingly harder and do them often. Of course, while you're going through treatment or recovering, it's okay to have a day off or take a break, give yourself grace. But ideally, you're doing brain engagement that is challenging for yourself. Excuse me. 6, time matters. Ideally, you want to start doing cognitive challenges, and we'll talk more about this as we go on, during or soon after your treatment, if you're noticing changes with memory and thinking. If that wasn't the case, as it's been a while, it's okay. It's not too late. You can start now. 7, salience matters. You want to do things that are personally meaningful to you. For example, pairing something to learn or something challenging with a reward. Work on things that are enjoyable to you. If you like doing Sudoku, for example, and that's memorable and meaningful, then do it. Use it as a brain game challenge. If it's not relevant to you, then find something that you enjoy. If you're using visual reminders at home, choose a color that grabs your attention. You want things that are motivational, novel, rewarding. This helps engage the brain system and make it more likely for you to take it in and to retain it. 8, age matters. The brain's ability to adapt and change varies across the lifespan. Generally, the greater gains are seen in younger adults than older adults. However, there's definitely a potential for improvement at any age. 9, transference. Practicing one's skills can improve on a related skill. With memory training, for example, you might also see gains with your attention, focus, other areas. And finally, 10, interference. For example, if you're challenging yourself to learn a grocery list, and then you immediately try to learn a second list with similar words, the second list may disturb what you're learning, the first list. So it's important to space out and pace yourself, taking breaks. Let's move on to cognitive training. This involves working out the muscles in your brain, doing repetitive and increasingly challenging tasks. This is often done independent and on a computer. I put down a bunch of free, or at least I hope they're all free, brain apps for various exercises. But what I want you to keep in mind, to beware of programs that charge money or promise results. There's no magical brain app or brain game out there. Really, the key is doing a variety of cognitive challenging things. At the bottom, I put down some relaxation apps. These are not brain exercises, but when we talk about energy level and pacing ourselves, we'll go over this more. But one that I really like at the bottom is the UCLA Mindful Awareness Research Center. That has a ton of free relaxation exercises. And there's a particular one called Body Scan for Sleep, which I love to help you clear your brain if you have a lot of stress or can't shut off at night, and help you go to sleep. Now moving on to what we do in speech therapy or cognitive rehabilitation when we're working on memory. So a few suggestions as a way to help you compensate would be using a daily planner, either a calendar, a notebook, smartphone, dry erase board, something to track what you have to do each day. I'd say find what works for you, be consistent with using it, and try to consolidate. Sometimes people will come in and say, I have a calendar in 3 different rooms, or I have one in my purse and one on my phone. And if you're matching them, if you write the same thing in both of them, that's fine. But sometimes having multiple planners is a little bit overwhelming and you miss putting it on one of them. So try, ideally have one main calendar that you're using. If you like to have a handwritten calendar and that's what you're used to using, stick with it. That's great. There's definitely some evidence showing that when you write and you see it, it helps you remember it. But if you prefer more high tech in your smartphone, use what works for you. Another thing that's important for memory, like I talked about with the brain adaptation examples with neuroplasticity, is setting up routine or structure. Even though you might be retired or you don't want to have such structured day, having at least, for example, eat your meals at the same time, plan your rest breaks or your exercise at the same time. Setting up that routine can definitely help with memory. Next, making lists, using a notepad or electronic device to track things for, say, the grocery store, or important things that you want to make sure you get done that day, can be helpful with remembering. Some people like to use alarm reminders, either on a clock or on your phone, reminders to take medicine, reminders to get ready to leave for an appointment, and bright visual reminders. I'd say if you're going to put up a bright sign, use a piece of paper that's colored, and then making sure you remember to switch it every once in a while because it tends to blend in with the wall and then you forget to look at it. All right, so Post-it notes. I see lots of people that come in and say their way of tracking things is with post-it notes. This obviously is a joke. Nobody hopefully has this many post-it notes, but I'd say if you're going to use post-it notes, maybe have one or two, and then when you're done with it, throw it away, but you want to avoid overload. A few more memory suggestions: having one main area to keep all your important things, whether it's your calendar, your notes, your wallet, your keys. See if you can bring a friend, take notes, record it, ask for, I mean, most doctors give the after visit summary, but those are a few other suggestions. And then another memory tool is to use a mental checklist. So for many people, you might walk into the kitchen planning to get a cup of water, but then you get into the kitchen and, oh, what am I here for? So get into the habit of pausing, asking yourself, what was I doing? What do I need? Scan the room, see if something will trigger your memory. Oh, the cup. Yep, I need water. It certainly doesn't work all the time, but sometimes bringing that awareness, the mindfulness, and slowing down, thinking about it can be helpful. Another thing that you might experience is reduced attention, concentration. So a few suggestions would be focusing on one thing at a time, using active listening skills during conversation, meaning if someone's talking and it's a lot of information, you might say, excuse me, can you repeat that? Or let me summarize what I just heard, to make sure you're taking it all in. Another thing to help with attention is to minimize distractions. That could be physical. If you are uncomfortable and you're, say, having dinner with your family and you're uncomfortable and you're focusing on that, you might not be able to pay attention to the conversation. So get a pillow, do something so you're more comfortable. Minimize auditory distractions. If you're trying to have a conversation and the radio's on or the television's on, it's hard to filter that out. So get rid of the background noise. And then the visual distractions, if there's too much in front of us, too much clutter, it makes it harder to take things in and focus. Another suggestion that falls under attention would be, or to help with attention, excuse me, would be pacing yourself. So taking short brain rests. A way that we recommend doing that is having a quick break, maybe 3 to 5 minutes. This is not a nap. This is a quick brain rest where you get rid of any visual distractions and any auditory. So you close your eyes. Hopefully there's no background noise. Maybe you go into the restroom, you close your eyes, you take a few deep belly breaths in through your nose and then out through your mouth. Your eyes are closed. You're doing the breathing for a few minutes to reset the system, and then you go back to doing something. So sometimes people will say that they can't focus very long. They love to read. They can't focus for an hour like they used to. So maybe they do 5 minutes and then they get tired and they do a quick brain rest and they do the breathing and then try to go back to it. Maybe they can't go back right away, but they go back later. Or you do whatever the activity is, you're doing something and you're getting tired, but you don't necessarily need a nap. You pause and you do a quick brain rest. All right. And so when we think about our attention and overall cognition and our energy, we all have a limited amount of mental energy and focus each day. And so we have to, especially now, as you're going through treatment or recovering, you want to prioritize with how you spend your mental energy. So I love this picture or the brain books and the example of trying to think about our mental energy in terms of this money. So you have, say, $10 a day, and you have to figure out how you're going to use it. Maybe you know that you do best in the morning, you have more energy. So you plan your appointments or your outings, visitors, etc., in the morning, and you use more of the brain bucks in the morning. Or you know that next week you have a family gathering at 6 p.m. and that day you'll save your brain bucks to use more of them in the evening, so you'll be able to participate in the conversation and engage with everyone. All right, so this is not a picture of my child's room, but it could be. But the idea with this is attention and clutter. Our brain is processing everything around us, whether we want it or not. Our brain has the ability to ignore most things, but if you have an environment that has a lot of visual clutter, some of those potential resources for focusing are diverted to the other things. So it's best to try to reduce the amount of clutter that you see, and that will help with focus, and that'll go a long way. Another thing that can happen during and after treatment is trouble with word finding. So for example, you have a pen. You know you want to say pen, but you just can't think of the word. So a couple strategies would be to pause, think, see if it'll come to you, a few seconds. If it doesn't, then you want to talk around it and keep going. So you describe it. The small thing made of plastic with ink, you write with it. Use another word, a synonym, another word that means something similar. Use other semantic features, meaning describe it with what it's, how you use it, what it looks like, the category it belongs to. So it's similar to a pencil. It's a writing implement. You use it for writing. It makes me think of my diary, something like that. Talk around it and keep the conversation going. So we talked about some things that you can do to help with any cognitive difficulty you may have. At the beginning, I said that there are some other factors that can affect our thinking. So when we look at this chart here, we see at the bottom where it says energy. Energy is the foundation for our thinking, for our cognition. When we have energy, we can do all the things that go up in the pyramid. We can quickly take information in and process it. We can focus, we can filter out noise and distractions, we can multitask, we can remember, learn new things, and stay organized, plan, manage time, make decisions, etc. But at the bottom, you see that there are things that can affect our energy and can affect our thinking and make us less efficient. So if we have pain, that zaps your energy, makes it harder. If you're not sleeping, that makes it harder. So working with your medical team, trying to think about like good, what we call sleep hygiene, meaning no screen time an hour before bed, do something nice and relaxing before bed. If you have a lot of stuff that you can't get off of your mind, write it down. Do like a brain dump of all the things you're worried about. I showed you that app a little bit ago, the UCLA, the body scan for sleep. So trying to work on getting better sleep is helpful. In addition to the sleep, I like to put that pacing, those short brain rests. So certainly if you need a nap during the day and it doesn't affect your sleep at night, do that. But also try to do those short brain rests to reset, where you close your eyes, the deep breathing for a few minutes to reset, to give you a little bit more energy too. You know, the illness, the going through the cancer treatment, that in itself zaps your energy, and giving yourself grace that, you know, you might need a little bit more of a rest. It might be a little harder day, but hopefully the next day you can get back to doing some of the things we talked about. If you have balance and vision issues and you're focused so hard on not banging into things or not falling, that zaps your energy and makes thinking harder. Nutrition. If you have nausea or diminished appetite and you're not eating a lot, you don't have that energy to help with thinking. So try to work with your medical team to figure out what will work for you to make sure you're getting enough intake. And then finally, the two big ones would be stress and mood. If you have anxiety or depression or other a significant amount of stress, of course, that makes thinking less efficient. So not only are the exercises and the tools important, it's also important to think about these other things that might be contributing to the cognitive challenges you're having. Some general recommendations for everyone for overall brain health moving forward. You want to make sure that you exercise your body, whatever you're able to do, whether that's stretches or chair yoga or a little walk or something um, more cardiovascular, whatever you're able to do. Exercise your brain, which is what we talked about, all the various things you can do at home, making sure you're eating right, getting good sleep, socialize, that's important for communication and cognitive health, and managing the stress. We talked about various things that you can do, whether it's games, other activities, other tools for memory, attention, word finding. If you feel that the cognitive changes you're experiencing are persisting and you're concerned with them or they're affecting your day to day, I would recommend asking your medical team for a referral for speech therapy. We are able to help you with things to do at home, if you're working in the community, to improve memory, attention, word finding, and overall energy level and cognition to make you more efficient. And if you are returning to work, we can help with coming up with possible adaptations you might need at work in terms of easing into work or part-time or breaks, things like that. Currently, I am the speech therapist at Legacy Manual. In the new year, I'm moving to Good Sam. If you're in the Legacy system, I'm happy to see if anyone wants to see any of you, or go to the speech therapist in your local area at your hospital or in the community, but ask your medical team if you are still having concerns. All right. Well, that wraps it up. I hope people have a few takeaways, and I wanted to thank everyone for having me today. And thank you so much, Lori, for organizing this. And I'm happy to answer any questions you might have.